Mr. Hussaini Abdulhamid, who is a member of the Oracle College of Scholars, this morning works with the Emirate College of Health Science and Technology, Kano. He is a dental therapist. This morning, he will be presenting on the topic Artificial Intelligence in Dental Practice. Mr. Hussaini Abdulhamid, the floor, you can go ahead and make your presentation. Thank you, sir.
Okay. Good morning, the lead mentor in person of Dr. C.DTher. Good morning, the moderator in person of Silas Agai. Good morning, fellow colleagues, and good morning, listeners from all over the world. I hope you can hear me clearly. I hope you can hear me clearly, right?
Yes, we can hear you, sir.
Okay. This morning I am going to be presenting
yes, we can hear you.
Okay, this morning I am going to be presenting a paper on the topic Artificial Intelligence on Dental Practice. And here is the outline of the presentation. Okay, we have the introduction. We have the artificial intelligence. In this outline, this is where we are going to see the overview and the concept artificial intelligence. After which, we are going to look at the benefits of artificial intelligence. Then we are going to look at conclusion, and then we have the references. Next slide, please. Okay, the introduction. We said since the invention of digital computers in 1940s, they have been used to solve complex problems, including performing some functions that were basically performed by human beings. That is before the invention of computers. The first generation of computers were introduced in 1940s. And until then, due to the fact that computers are being made in order for them to make our work easier, efficient, and then less time consuming. So, and we know basically this is the interest of human beings. We always like to rest. We always like our work to be more perfect, more efficient, and less time involved in the work. So a lot of interest have been picked in the area of computer. That was why since then computers have observed tremendous progress. 1940s, 1950s, 60s, 70s, 70s until now, there has been what? Rapid development in the area of computer. If you have to look at various disciplines that we have, like say medicine, technology, transportation, and other areas, you are going to see that there is no area that have seen rapid progress as fast as the area of computer. So these computers that have started as first generation, second generation, and third generation, fourth generation, and fifth generation of computers have now evolved to be what we call artificial intelligence. If you look at the first generation of computers, you are going to see that they are something very big. They are made up of transistors. You are going to see a computer as big as a house. You are going to see a computer so big so that when it is mounted, it cannot be mobile. But today we have computers that we put in our pocket and we move around with. So we have the second generation of computers that were reduced in size that were being made of integrated circuits. So they are a little bit more convenient. They can be movable to an extent. We have the fourth generation. They are also the major improvement that is also made in this fourth generation is the improvement in size. The size was reduced, and this improvement was made around 1970s. Then coming down to the fifth generation of computer, which is the artificial intelligence, which started in 1970s. The computer, after they were being dramatically reduced in size, they were being start to be incorporated with what? With features, with qualities of human being, which we are going to see when we proceed. So, uh, artificial intelligence, as far as the definition is concerned, we say it is referred to as the ability of a digital computer or computer control robot to perform tasks commonly associated with human beings. There are some tasks that before the invention of computers, they are basically human. If you look at the industrial age, you are going to see that the major achievement we made during that time was what? Was to connect human beings, was to work collectively as a team. That was what was only able to make us to move forward in the what? In the industrial age. But this is information age. We are progressing by what? By connecting ourselves to computers. They are the only tools that are being used to what? To connect in between one person and the other technologically from distance. If you look at what computer have done to us today, you are going to see that if you look at the major technological companies that we have today, like Facebook, like Twitter, like YouTube, and the like, when have they started? Like Facebook started in the year 2004. Look at it today. Facebook is known in every aspect, in every corner of the world. You look at YouTube, almost the same. YouTube started later when Facebook was started. So the same thing applies to almost all other technologies. When when we want to contrast in between technological based products and product physical product, you are going to see that the technological based product moves faster. The only difficult aspect of technological product is what? The invention. But the moment the product is invented, in no time you are going to see that it have cut across all the areas of the globe. So next slide, please. Next slide, please. Uh, so artificial intelligence continues. The characteristics or the features of human beings that are being exhibited by the artificial intelligence include number one, reasoning. So what is reasoning? Reasoning is the action of thinking about something in a logical way or to differentiate between right and wrong. Computers today exhibit this thing. They exhibit reasoning. There is a game, chess, that was played in between a computer and a human being. And it will take you by surprise to know that after some practice for a while, the computer have mastered some trick that it have outsmarted human beings in the game. And this is a game of logic and reasoning. So today computers used to reason a lot and they used to what? They used to perform some logical tasks. So secondly, learning. What is learning? Learning is the acquisition of knowledge or skills through study or experience. Computers today used to learn. They used to what? They used to recognize patterns. They used to gather data and drive meaning out of the data. Even after driving meaning out of the data, they would respond and perform tasks. So the same way we do as human beings. When we want to act, we usually act based on what? Based on what we have in our mind or based on the knowledge of the thing that we have. So as well, computers have emotion. I want to believe that a lot of us here have seen Sophia the robot that was interviewed, and particularly that robot was being developed and was being introduced emotion. So I think at some point during the interview, when Sophia the robot was asked uh, whether she fear for domination by human beings, she said she doesn't have any fear for domination by human beings, and she doesn't feel threatened. The only thing is, if human beings are going to like to dominate her, then that is the only time when they are going to respond as human beings. So the same way we feel fear of what domination, the same way robots were being were being were being introduced emotion, and the same way they fear for what being dominated by human. They are now looking at as their what as their counterpart. So apart from emotion, there is also recognition. So what's recognition? That is the action of identifying either an object or something in order to what? In order to recognize it. When you see an object for the first time, it is expected that when you see it for the second time, you are going to what? You are going to recognize it. This is basically because of the ability of our brain to trace the memory that we have. If as a child you are growing up and you are developing your brain, as you are seeing objects, you will get to know that, oh, this is a pen. Oh, this is a cup. Oh, this is glasses. And with time, when you see that object, until it adapted to your brain and it become your regular pattern, when you see it, you are just going to know that this is that. So that is recognition. So four these four basic tasks, reasoning, learning, emotional recognition, have been executed by artificial intelligence today. So let us look a little bit further and see their use application in dental practice. So AI can perform a number of tasks in the dental clinic with greater precision, less staffing, and fewer errors than the human counterpart, like booking and coordination of appointments. We know that traditionally we used to what? We used to book our patients and coordinate appointments for them in the clinic. Let me tell you, if you have to use this artificial intelligence, you are going to see how you are going to tremendously upgrade your service and make it very efficient. Now, you don't need to be what? You don't need to be scratching your head to be able to remember who do you have in your next coming appointment. You can even be able to use mobile applications and remind your patient of their appointment and also get update on the appointment that you have. You can as well have mobile applications that are being programmed with this artificial intelligence and use them in order to book patients for you. I have actually a Facebook page. It is a business that I intend to develop. It is dental online. I used to give a lot of educational content in that page that informed individuals about their oral health. So they have a future. Facebook have a future for booking. Someone can easily book an appointment. He can schedule the appointment within the range of the timings that I made available on the page. And if someone book an appointment, I can easily see that he books so time. So before that time, they can remind me. I can log into the page. I can be able to what? Be able to consult the patient. So that is to tell you how good artificial intelligence can be in this aspect. So there is also assisting in clinical procedures. There are a lot of clinical procedures that can be done with the aid of artificial intelligence. In fact, artificial intelligence have evolved so much so that there are some clinical procedures that can be performed 100% by artificial intelligence, completely without the input of human counterpart. So, like for instance, there is an implant that is being conducted by an artificial intelligence. Basically, if a human counterpart conduct an implant, there used to be 70 to 90% efficiency. But when artificial intelligence conduct this implant, it was made that there is 94%, I think, to 99% efficiency. So you can see the differences. So let us look at the next slide. There is diagnosis and treatment planning. uh, Artificial intelligence can be able to what can be able to help you in your diagnosis. There are different sets of computers. These computers can see, we use our senses in order to conduct examination, sometimes assisted with laboratory or radiographic investigation. But basically, as far as dental practice is concerned, majority of our examinations used to start from what? From physical assessment. So we used to touch, we used to feel, we used to oscillate, we used to view in order to what? In order to perform our examination. And it is almost established now that computers can be able to perform the whole of these tasks more efficiently as far as you can be able to to do it. If you are going to see, if you are going to match in between two shades, then computer can be able to do it even better than you can do. So computer can aid drastically in what? In the diagnosis and treatment planning. It can be able to detect maybe, let's say, a apical apical involvement, maybe in maybe in maybe when you want to perform maybe a root canal therapy, or when you want to perform fillings. You can be able to view and detect accurately in millimeters the involvement of either the dentin, either the pulp, either the apex. So there is dental co-management apps. That is also part of the benefit of artificial intelligence. These There are different kind of apps that has to do with teaching, learning, and then practice of what? Practice of dentistry. In 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 colleges today, we have simulation, we have tools, artificial intelligence tools that are being designed that you can be able to have yourself in immersive technology where you are going to be involved. You where there is virtual reality glasses, those kind of glasses that you wear, and then you are going to be seeing things physically as if they are occurring live. And then there is augmented reality that after when you are viewing the things, you can even be able to what? Touch. So students can explore these opportunities to be able to make them learn more efficiently without the risk of having them to perform on live patients. So in general, artificial intelligence applications show high accuracy, sensitivity, specificity, and precision in detection and classification of malocclusion in orthodontics. This is just to give an example. This is according to a research by Karazani et al. Being conducted in 2020. It is proven and established based on that research that artificial intelligence shows high accuracy, sensitivity, specificity, and precision in detection and classification of malocclusion. That is to say, when compared with what? With human counterparts. So this does not just limit to what classification of uh, of of malocclusion in orthodontics. I know the same applies in what? Shared recognition, and can as well be applied in other areas of dentistry. Next slide, please. And we see next slide. Okay, based on the findings of a systematic review by Nasir Ahmed et al., according to research being conducted in 2021, he have these two major findings, and these were his conclusions. AI technique assists dental practitioners in numerous ways, from decreasing the chairside time, saving extra steps. That is to say, if you have to perform maybe 5 steps in a procedure, then artificial intelligence can be able to help you in limiting the number of steps. Maybe you make them 2. We know of single visit root canal therapy treatment that we used to do. The reason of uh, making the visit more than once, maybe twice or thrice or thereabout, is because you will have to test and make sure that the infection in the canal is completely eliminated. So when you have other means of determining if the infectious canal is the infection in the canal is completely eliminated, then someone can proceed with what? With a single visit or canal treatment. So this might not be achieved without the need of what? Extensive computers that can be able to what? Help you in this diagnosis. And before they can be able to perform this diagnosis extensively, they need to exhibit the feature of what? Human that we use, as explained earlier, that we use our senses in what? Examination. So it is established that they are good in achieving excellent infection control. They are good in providing quality treatment with accuracy and precision. So next slide, please. So AI can be successfully used for patient diagnosis, clinical decision making, and prediction of dental failures. Hence, it is reliable medically for future application in oral diagnosis, oral and maxillofacial surgery, restorative dentistry, prosthodontics, orthodontics, endodontics, forensic dentistry, radiology, and periodontics. You can see almost all the disciplines of dental practice. AI intelligence have use cases. So I will implore us all to be able to tilt toward artificial intelligence, because it have a lot to do with improving our practice. So in conclusion, the benefit of AI in dental practice can hardly be overemphasized. It is part of the major drivers of technology that play a significant role in the development of dental profession. Thank you very much for listening.